Hey guys, happy Tuesday. Time for Tidbit Tuesdays. And it's a glorious, beautiful day outside. So, again, I decided to head outside and get this Tidbit Tuesday kicked off. So, it seems like there's a lot of more details coming out about the rescue plan, the American Rescue Plan that was assigned into legislation. Besides, everyone's probably very familiar with the subsidies that plan is giving people if they qualify. There's a lot of information that people don't know about insurance that's in that plan. And I'm finding out more details really every day. And I'm trying to get this information out there to you guys so you can at least talk to someone to find out if you qualify and all those good things. So I talked about that right now is a special enrollment period. That is certainly one of the things that the act did, was to allow you to sign up through May 15th for coverage on the marketplace. It also lowered or actually increased the subsidy for some individuals, depending on your salary income. If you make as little as $19,000 a year, all the way up to like, it varies depending on how many people are in your family, but you will qualify for some subsidy on the marketplace. The little bit of a drawback to that is that all the plans are not updated yet in the marketplace. I don't know why that's taking long. I would think it's a formula they just have to plug in. But what I've been told and what I've read is that if you can go on there and get coverage and you do qualify for more of a subsidy, that should be automatic retroed back, so that you will, once they put it in place moving forward, you will get the lower rate. And then apparently it's going to wash itself out on taxes. They may not refund you that money. You know, there's a lot of paperwork involved with doing all of this if it's not in place to start with. So they may not refund you the money, but when you do your taxes, that's when you'll see the refund of premium due to the new subsidy limits, and also unemployment. So what I've also read, and a little bit of the research that I've done, is that if you're currently on unemployment, that you qualify for $0 health care. But again, the problem being is that it's not updated necessarily in the website. So I tried to help a client the other day and plugged in their unemployment amount, and it still showed they needed to pay $200 a month, and that's not right. It should be $0 for the silver plan. So I keep checking to see if that's been updated. You can certainly talk to somebody, a licensed insurance agent that handles marketplace insurance, that can help you. The COBRA subsidy is 100% of COBRA payments from April 1st through September 1st, if that's 6 months. So that you're going to have to, again, I'm reading on this. It looks like you have to contact the employer. You have to currently be on COBRA, and you're eligible to continue to receive COBRA, because it does not extend. If your 18 months is almost up, then it does not extend that, but you will get a COBRA. Basically, they're going to pay the COBRA for 6 months. I'm not sure how all that's going to work out, but the employer is supposed to be working, I guess, with the government to get that paperwork handled to whatever they need to do to get the money so that you have active coverage. So, and also, I believe, again, if you're paying COBRA, that you will be able to figure that out on your taxes. It will retro back if that all doesn't work out in the wash. So it's great that these things are coming into place that give people help. If they need insurance, they can't afford insurance, worried about being sick, especially right now during a pandemic. It's a great thing to have. The only thing is there are some things to work through. It's not as easy as just sending out a check to everyone with a Social Security number that their income is less than a certain level. So it's a little bit more involved with insurance. I understand they have programmers or coders working around the clock trying to get all these things in place so that you can go in and shop, because I know it's important. You know, my whole point, these things are great, but the client I was trying to help doesn't have $200 a month to pay and wait to get reimbursed later, or maybe even next year when they do their taxes. So it needs to happen quickly that this is put into place. We can check periodically to see if it's been updated. You can actually go to my, I have a, happy to send you a link. I have a great marketplace tool that's easier to use than the marketplace. And if you want that link, you can just shoot me an email, shoot me a text, and I can happily send you that link where you can look, compare plans, see costs, and that also puts you in my little queue that I could be your agent of record. And by being your agent of record, there's a lot of things I can help you with: saving money, cost strategies, picking new plans when those come available next year, looking at the back end, seeing what your benefits are, and getting you ID cards and all kinds of fun stuff like that, that if I'm your agent of record, I'm more than happy to help you with. My website is jcapconsulting.com. You can actually also book an appointment with me through that website. I have a Calendly link on that you can go there, book a time if you just want to chat, know what your options are, see if marketplace coverage is the right coverage for you, or if you would rather go with something else. You've picked something, it's too expensive, you still have an opportunity to change that. There are private PPO plans out there that may be a fit for you, but I'm always going to shoot straight with you and let you know what the best option is for you. And one last tidbit before I go: COVID vaccines are free. If you're going somewhere and they're trying to charge you, you should not be paying for COVID vaccines. The federal government is subsidizing that. If you choose to go get a vaccine, then they do want your insurance info so they can try to collect some of that money. But if they can't collect, the federal government's going to reimburse them. So keep that in mind when you're going. If you can get an appointment, I see people all the time trying to schedule and they can't get on and all that good stuff. But that's my last tip in for today. So remember, jcapconsulting.com. You can go to my website, request an appointment, be happy to chat with you. You can go to my website and just check out everything I do. And until next week, peace out.